delighted to welcome all of you on our seminar to world-class professor with the topic Exploring the Needs and Challenges of the Implementation of WHO Health-EDRM in Indonesia. This event is also a part of the 13th Aceh International Workshop and Expo on Sustainable Tsunami Disaster Recovery 2021. First of all, let's deliver our gratitude to the greatest God who has given us guidance, happiness, and health, so we can attend and participate in this special event without any obstacle. The Honorable to Dr. M. Shamsidik as the Director of TDMRC Indonesia, the respectable Professor Cordia from Griffith University, also the Honorable to all of the speakers and the guests in this room today. Ladies and gentlemen, please let me welcome our outstanding speaker of the day, Dr. Ryoma Kayano from WHO Kobe, Japan, Connie Ph.D. from Griffith University, Australia, Dr. Rina Suryani Oktari from Faculty of Medicine, Universitas Syekh Kuala, Indonesia, Dr. Tao Liu from Guangdong Institute of Public Health, China, and Dr. Huang Xuan Nguyen from Faculty of Public Health, Da Nang University of Medical Technology and Pharmacy, Vietnam. Today's event is also going to be guided by Febi Rahmadi, Ph.D. from Griffith University, who is our moderator of the day. Ladies and gentlemen, before we jump to our main event, let's listen to opening speech by Professor Cordia from Griffith University. To Professor Cordia, the time and place is now on your side.
Okay. I'd like to share my screen. Can you see it? I cannot start the screen sharing.
Yet.
Okay. It says that I cannot start screen sharing. So is that okay now?
Yeah.
So, cannot see my screen. Can you?
Not yet, Professor. Yeah.
So, can you see my screen?
Yes, it's clear now. Yeah.
You can see the screen now?
Yes, you can see the screen now.
Okay, thank you so much for inviting me in such a meaningful conference. And I'm meeting a lot of old friends and new friends as well. And with the opening, I still like to offer you this thing that is linking climate change adaptation and disaster risk reduction in the era of pandemic and climate change is such an important issue today. And that I would like to offer you that the key point basically is about climate change is intensifying and increasing the severity of disaster and extreme events. But despite mounting evidence of impacts that jeopardize our next generation, we are still slow to adapt and short on actions, particularly linking what we talk about is disaster risk reduction and climate change adaptation so that we can enhance our response effectiveness. So let me start a bit showing this diagram. As early as 2012, the IPCC report already stressed the need to integrate disaster risk reduction and climate change adaptation approach. And you can see that that's really important. What does that mean by disaster risk reduction? It's really about comprising a range of activities undertaken to minimize vulnerability and disaster risk, limiting the impact of hazard and danger within the broad context of sustainable development. So by then, the world actually start looking at disaster risk reduction and sustainable development. So important. So a journey through time and space by the time that from 2008, I was just showing you the concern about sustainable development, and 2012 about linking the disaster risk reduction and climate change adaptation. By the time we look at 2019, we definitely highlight the importance of this pursuit for sustainable development. And okay, so what does that mean by climate change adaptation? Adaptation means that the process of adjustment to actual or expected climate and its effects. In human system, adaptation seeks to moderate or avoid harm, or exploit beneficial opportunity. Not just about harm, it's about if that is good thing, how can we exploit that and do better? So now let's look at what does that really mean? Well, what we mean that we factor in climate risk into decision making, particularly in disaster risk management as well. We need to use an evidence-based risk management approach. We want to help the vulnerable. If you have only limited data, you want to focus on helping the most at risk, most disadvantaged. But that really takes a lot of effort about collaborative. It's a value-based approach. Vulnerability we must address. And we need to revisit decision and outcome over time. But importantly, it's about sharing responsibility at the whole well. So you can see the reason is that there are a lot of linkage of disaster risk reduction and climate change adaptation in health. And we find a lot of commonality that we really need to exploit so that we can do better. So this means that scientists and researchers must communicate effectively with stakeholders to find useful and usable solutions before we reach the tipping point. What does that mean by tipping point? Well, if that's the point of no return, if the threshold that is crossed could have very severe consequence for our well-being. One example, if the threshold for loss of the Greenland ice sheet is crossed, sea level could rise by up to 7 meters. And so you can imagine if that crossed, then there will be a loss of coastal cities area will be at stake. So with that in mind, climate change and health impacts very severe. And that by the 1918, we find that marine food security and undernutrition, the vulnerable population particularly in danger of heat wave. We're talking about change in labor capacity because they can't work due to a lot of our loss. The wildfire is also linked to that, flood and drought. And we talk about illegal weather-related disasters, climate suitability for infectious disease transmission. The top one will going to be really tougher, and the transmission will be for us to really having to face with. And that means that healthcare facility and emergency service may be stretched to the limit. So what does that mean? By 2019, the report from the Lancet Countdown, they actually make this declaration. They say, we must ensure the health of a child born today is not defined by changing climate. So the whole series of reports all focus on this 3 points. The child born today will be profoundly affected by climate change. That's what they mean by defined by climate change. But there's some positive news. That means that we have a second path that limit the global average temperature rise to well below 2.C, hopefully below 1.5, is possible. And that will transform the health of a child born today for the better, right the way through their life. But that means an unprecedented challenge depend on demands and unprecedented response. It will take the work of the 7.5 billion people on Earth currently alive to ensure that the health of a child born today is not defined by the changing climate. So that comes to the concept, we need to future-proof ourselves. And before the time is running out, the entire society must take a partnership approach to find useful, usable solutions and act on them. And that is really important, means that we need to link climate change adaptation and disaster risk reduction with the sustainable development. Scientists, researchers, and stakeholders must build partnership to co-create useful policy and practice in the pursuit of a sustainable future. And that's what we are here today. We are creating a future. And then we're working across country, working across discipline. We want to actually have a future-proofing action for sustainable development. And that means linking climate change adaptation and disaster risk reduction is a holistic way towards sustainable development. And with that, I wish the following conference go well, and I wish you well, and thank you very much.
Thank you so much to Professor Cordia for giving us such fresh opening speech. Before we listen to our invited speaker, first of all, I would like to say hi to our Director of TDMRC, Mr. Shamsidik. Thank you so much for having us here. But before that, I would like to ask to all of the audiences to open your camera so we can have a picture together. Okay, to all audience, please open your camera so we can have a picture together. Okay. All right, we'll be having two screens. I'm gonna take the first screen. I'll count in 1, 2, 3. Okay, now we move to the second screen. I'll count in 1, 2, 3. All right. Thank you so much to all of the audiences. Now we'll be having our main agenda with the invited speaker. To all audiences, please listen carefully and don't hesitate to share your thoughts toward the information on the chat room or with our moderator, Mr. Febi Rahmadi. To Mr. Febi, now you are in charge. Thank you so much.
Thank you, Icha. Thank you so much. Good morning, good afternoon, good evening to everyone. Very much depending on where are you at the moment. And because this is an online webinar, so I believe everyone is. Because we have speakers coming from Vietnam, from Australia, from Indonesia as well, and probably we also have participants coming from other countries as well. So it's a pleasure for me to be here as the moderator of this webinar. So probably we can remove the screen if that's possible. All right, so and also thank you so much for inviting me to be the moderator, and of course distinguished guests and respective probably here we have also invited speakers. Assalamualaikum warahmatullahi wabarakatuh. So please be on all of us. And so today my job is I have a very important job today to be the moderator of this webinar, and I'm very happy that all of the speakers are actually my own colleagues. So we have the first speaker, we have Dr. Rina Suryani Okari, which I believe most of Punjab people already know her. And then the second speaker we have, and she is also my colleagues as well, Dr. Hopefully I can pronounce her name correctly, Heng. So Heng Xuan Nguyen from Vietnam. And the last one, we have Dr. Connie Gan. And So today our topic will be about the WHO, the newly launched WHO EDRM, which is stand for Emergency Disaster Risks Management Framework. As Professor Cordia has already mentioned in her presentations or in her opening speech regarding the importance of using the translational research, the practice that or the research that is based on the evidence that can be used and also usable for us to adapt to the climate change, because climate change is something that is happening at the moment. And also not to mention as well with the natural disaster, which is also exacerbated by the climate change impact as well. So it is important for us, I think, here in the context of now we are pulling 3 different countries, the example of 3 different countries. So we are very lucky today. So we have people coming from these, 3 different, regions. So we have from Vietnam, we have from Indonesia, and we also have coming from China as well. So unfortunately, Dr. Yoma cannot join with us, and also Dr. Tao from Guangdong province. So, but hopefully it won't reduce the quality of the discussion that we are going to have this evening. So without further ado, because we need to know what is this, framework is all about, how this, will interact, with the existing framework, because, like every year we can have a new framework, but what is important for us is what is workable for us. What, how can we make sure that we can contribute to the benefit of the people of the community. So I would like to invite our first speaker, Dr. Rina Suryani Oktari, or Okta, to present, to share her knowledge, and also because I understand you're currently still on the paper or the manuscript is still in the process of finalizations to become a published paper. Hopefully that manuscript can become a published paper soon. So probably you can share with us, from Indonesian perspective on how Indonesia could probably apply this framework. So Dr. Ina, over to you. So because we only have about 1 hour in total, with 3 speakers, I would say maybe 10 to 15 minutes maximum for you to present your presentations. And then after that, we will then follow with the second and then the third speakers, and then we are going to have question and answer session at the end. So Dr. Rina, over to you.
Thank you very much, Kak Febi, as a moderator for today. And Assalamualaikum warahmatullahi wabarakatuh, and good afternoon, everyone. Thank you for joining us in our special sessions. And thank you for Professor Cordia, who has already delivered her opening remarks, and also for Dr. Syamsidik as our head of TDMRC Universitas Syah Kuala. And thank you for all participants who joining us on these sessions. I would like to share my screen. Okay. As an introduction, this special sessions is actually a follow-up of our collaborative research projects with Griffith University, and also with the Guangdong CDC Institute of Public Health in China, and then also Hanoi School of Public Health, and then Da Nang University of Medical Technology and Pharmacy from Vietnam. So I would like to present our finding on the scoping review. We did the scoping review for the scientific articles and the policies and real literatures, but for today presentations, I would like to share only for the policy. So This is my title, Health Adaptations Policies and Strategies Towards Climate-Related Disaster and COVID-19 Pandemic in Indonesia. Initially, our scoping review didn't cover the COVID-19 pandemic, but maybe at the end of my presentations, I would like to provide some updated on how the stakeholder collaborations and coordinations exist in Indonesia to deal with the COVID-19 pandemic. So this is the background, as we are all already know that Indonesia is highly vulnerable to climate-related disaster. And Indonesia is also ranked third among the world's largest incidents of flood disaster from 1,900 to year 2020. This is according to the EMDAT database. And also according to the Indonesian disaster information data from 2005 to 2019, more than 78% of disaster events were a hydrometeorological disaster, including floods, extreme waves, lands, forest fire, drought, and extreme weather. And disaster events are becoming more frequent, intense, and complex. And every year, over 190 million people affected by disaster. And the full impact on people's health is far more significant than this. So our review objective is first to identify and map policy documents that related to climate-related disaster and health impacts. And then the second one, to determine how the policies related to climate-related disaster and health impacts, and to address health impacts among the vulnerable groups, and then establish any gaps within the policies in terms of addressing health impacts caused by climate-related disasters. And the last one is to explore the potential need for any future thematics or discursive analysis of how policy deals with climate-related disasters and health impacts. So if we're talking about the climate-related disaster, there are three key agencies, which is the Ministry of Environmental and Forestry, focusing on address the vulnerabilities from the environmental perspectives. And the second agency is the Ministry of Health, which is focused on reducing susceptibility and enhancing adaptive capacity of the individuals and societies. And the third one, of course, the National Agency for Disaster Management, which is focused on oversee general disaster risk management, governance, and community resilience building. That's why in our second manuscript, which is about the health policy towards climate-related disaster in Indonesia, we also involve these three agencies, including the Ministry of Environment and Forestry, Ministry of Health, and the National Agency of Disaster Management. So according to the Ministry of Health regulations, these are some health adaptations measures, including the information disseminations and advocacy, and then vulnerability mapping, improving the health system response, legislations, and then improving the health service coverage and health human resources, and also the climate sensitive disease control and prevention, partnership, also community empowerment within the local health adaptations, and the improvement of disease surveillance and information system. So according to our scoping review, we searched from the Google Scholar and tried to directly go to the official website. We found there are about 52 law, regulations, planning document, guideline, and evaluation report that related to the health adaptations toward the climate-related disaster. You can see here, this is the some of the institutions that has the regulations or planning document that related to the health adaptation. And we tried to analyze the finding using the health emergency and disaster risk management framework. The Health-EDRM framework itself consists of several aspects, including the policy, strategies, and legislations, and then planning and coordinations, human resources, financial resources, and then information and knowledge management, risk communications, health infrastructure and logistics, and then health and related services, community capacities for health EDRM, and then the monitoring and evaluations, and the last one is policy, strategies, and legislation. So we can see here some of the policies or regulation that released by our government already fit in this health emergency and disaster risk management framework. Because also if we go back to the definitions of the health adaptations covered by the Ministry of Health regulations, it also in line with some of the aspect of the health EDRM itself. So after the analysis, we found the gaps and challenges. These are some gaps, including the climate-related disaster and or human-induced climate change impacts have not been acknowledged in the current main disaster management law. And then also the interconnected nature of climate change impacts on health requires a set of interlinked stakeholders and policies. And then also lack of shared framework that engage multiple stakeholders for moderating climate change impacts on population's health. For example, most agencies involved in climate-related disaster are still fragmented. And then lack of coordinations across related institutions, and lack of policies that focus on cross-boundary information and resource sharing. Also, they're still ego-sectoral, which is a very persistent issue. Every stakeholder has a desire to raise their own flag, and most policies are still at country or national level. The translation to become actionable policies at local or provincial levels is still lacking. That's why this is the recommendations, including the existing law and regulation related to disaster management has to be more climate change sensitive, such as in the, because currently we are revising our disaster management law. Maybe the climate change should be mentioned specifically in the law, particularly as most of disaster events in Indonesia are climate-related disaster. And then the second one is to establish a shared or common framework that involves multiple stakeholders for the health adaptations, and the need to translate the national policies related into the local context. Because at the moment, only 2 of 34 provinces in Indonesia that have specific regulations on adaptations. And the last one is to strengthen the leaderships and facilitation skills for effective collaborative governance of health adaptations at local level. Yeah, this is just a brief descriptions on the COVID-19 situations in Indonesia. It started on March 14, 2020. The President of Indonesia declared that COVID-19 as a national non-natural disaster. This declaration was based on the beginning of the coronavirus spread in Indonesia and following the announcement by the WHO of COVID-19 being a world pandemic 3 days earlier. And the government subsequently developed a task force for the accelerations of the handling of COVID-19 at the national level, also followed at sub-national levels, including in our university. We have also the task force, which is Dr. Safriza Rahman. The previous keynote speech already presents on the roles of the university in the COVID-19 situations.
Yang mana yang sigma 1, yang mana sigma normal, yang mana yang effective stress, yang mana.
Okay. Then the government has also quickly shifted their priorities and resources to adequately support the COVID-19 response, and the impact of the COVID-19 pandemic was quickly felt in multiple sectors. This pandemic also has changed the perspective of disaster management phase of pre-disasters, emergency response, and post-disaster, shifting into a set of concurrent efforts of readiness, response, and recovery. So the United Nations country team and the humanitarian country team agreed to develop a multi-sectoral response plan, or MSRP, to support the government of Indonesia in addressing the COVID-19 situations. There are 14 UN agencies were involved in the multi-sectoral response plans to COVID-19 for MSRP implementations with initial durations from May to September and extended to December 2020. And this is some of the key important roles of the multi-sector response plans, including the planning as a planning tool, as a coordination tools, as a monitoring and evaluation tools, as a fundraising tools, and as a partnership tools. So from the SRP, there are some lessons learned, which include the MSRP is very useful in helping to develop a joint plan, assisting agencies to design their programs and nurturing new partnerships. And also this MSRP has been successful in increasing multi-stakeholder collaborations in the existing priority pillars. And the response plan has 5 main functions, which already mentioned previously. And there should be a consensus to decide on which functions of the response plan that the humanitarian community expect to be delivered, as well as where and how the available resources need to be strategically allocated to support the functions. And the response plan should be more dynamic and adaptive to enable more agencies to participate in the response plan even after the response plan has been published. And then there needs to be a structured effort to disseminate, socialize response plan once it has been published, and strengthening coordination mechanisms and resources for analysis and facilitating opportunities for collaborations between institutions. And then cross-sector collaborations would provide significant added value to have more synergy and integrated approach across sectors. And it is necessary to strengthen strategies and mechanisms for reporting, monitoring, and evaluations. Having mechanism to monitor effort at the local level will help local NGOs to nurture collaborations and coordinations. And good practices and local champions are helpful to inspire replications and scaling up in responding for the COVID-19 situations. Okay, that's all my presentations, and thank you very much. I'm looking forward to have more fruitful discussions with all the participants and speakers here. And I give back to the moderator. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Okta. Thank you, Dr. Rina Surani Oktari, for a very informative presentations. Sorry, hopefully I didn't push you, because I understand you have lots of information, but I have to push you, you need to finish by 10 minutes. But hopefully the participant could get what you presented, but later we can always, clarify, in the question and answer sessions after the presentations, okay? So it's interesting to see that what Dr. Rina has already mentioned, that from the Indonesian perspective, we got a lot of policies or regulations, laws, framework related to disaster, climate change adaptations. However, one of the most important part is the stakeholder engagement, stakeholder involvement, and stakeholder engagements or involvement will not be there without proper coordinations, right? So hopefully later on, after we hear all the presenters, so we can have further discussions on how we can then strengthen coordinations and make sure that we can contribute better to our community. So that was from the Indonesian perspective. Now I'd like to bring everyone to Vietnam. I haven't been to Vietnam. Hopefully, when COVID border has already been lifted, I can visit Vietnam. And so now from Vietnam perspective, we have Dr. Hung. Dr. Hung, sorry, I have to read your. So Dr. Hung is a senior lecturer. Sorry, you're a professor, senior lecturer. Dr. Hung, so senior lecturer of the Faculty of Public Health, Da Nang University of Medical Technology and Pharmacy, Da Nang, Vietnam. So Dr. Hung will speak about the health adaptation policies and strategies towards climate-related disasters and COVID-19 pandemic from the perspective of Vietnam. So without further ado, the floor is yours. Dr. Hung, over to you.
Thank you very much, Febi, for introducing me and let me have opportunity to attend this workshop today. Do you see my screen yet?
Yes.
Yes, we can see screen.
Yeah. So today I will talk about the health adaptation policy and climate. Oh, I can't. Sorry for 1 second. I need to learn how to use Zoom properly first. Okay. I will talk about the health adaptation policy toward climate-related disaster and the COVID pandemic in Vietnam. So my presentation will. Oh, why can't I move the slide? Okay, my presentation will have 2 parts. The first part is a finding from our project supported by the WHO about the climate-related disaster, vulnerable population and policy in Vietnam. And the second part is about the COVID-19 in Vietnam. And hopefully I can find some link between these 2 parts at the end of the presentation. So for the first part, we use document screening to find all the documents from legal document and academia document to find anything to talk about climate-related disaster, about the vulnerable population and the policy available in Vietnam. And so this is the source that we extract all the information from the academia one and from government. And so this is our finding. The green one is a scientific document about the climate-related disaster. The blue one are the national legal documents and yellow are the provincial legal documents. So you can see that research on this disaster and disaster prevention in Vietnam is very new and very few study working on this area compared to Indonesia and China. And this is a summary of what we found from all the research. And we found that this is a disaster happened in Vietnam in recent years. And we, from the north, we have a cold spell, drought, and flood. And from the centers of Vietnam, we have different types of disaster like droughts, cyclone, storm, heat wave, flood, and hurricane. And in the south and central coast, we have droughts, landslide, and typhoon. And from the south, we have flood, landslide, heat wave, and drought. So this is most common disaster in Vietnam. And to deal with this problem, we do have some document, and I can say most of the research only focus on all-cause mobility. So in short, we don't know much about the health impacts of the climate-related disaster, and that's why we only know some, we can only identify some vulnerable population like the elderly, the poor, and the children who have most affected by all the disaster in Vietnam. And to deal with this problem, we do have few policies regarding the climate-related disaster, and the second one is a national plan. But to be honest, we don't see many action follow this plan, because although we have plan, but the funding for that is very rare. And the most recent action plan we have is from the Ministry of Health. So this is the first one, health involved in the climate-related disaster policies. Previously, all the policy only regarding the disaster in general and don't really concern about the health. And in this policy, the Ministry of Health do regard the climate change impacts, and the action plan focus on enhance the health sector response capacity with the view to prevent and mitigate environment and climate-related risk factors that affect the healthcare system and people, contributing to people health protection, care, and promotion. And to get to that role, we do have specific role focus on improved mechanism and policy of the health sectors and raising awareness of the health worker on climate change adaptation and strengthening the healthcare system. But this new policy just issued in 2019, and we know that in this year we combat with the new emerged disease, that is COVID-19. So you can imagine a new policy just issue, and then the next year we come back with the pandemics. So not many action has been done by the Ministry of Health, because we have to put all of our effort to combat with the COVID-19. And as you remember, the COVID-19 was first emerged from China, the neighbor of Vietnam. That's why we got the disease very soon, right after the start of the COVID. And in this second part, I will introduce how we combat with the COVID-19 in Vietnam. I will give a small background on the COVID in Vietnam. So as soon as we know about the COVID, Vietnam has the first epidemic in January 2020, and that is the first pandemic, lasts for 3 months and has been controlled very well. During that time, we just do the normal action plan like we often do with other infectious disease. The second epidemic was started in July 2020, and it's emerged in Da Nang city. That is my city where I live now. And during this epidemic, we found that the whole healthcare system has been overwhelming, because the first case and almost all of the case were emerged from the hospital, because that's caused the situation become more complicated, because as you know, COVID-19 is most affected, the most dangerous for elderly and people with other disease. And this is a case in Da Nang city at that time. And during 2021, the epidemic like emerged almost the whole years, but mostly from May. And I will explain about how we combat it. So from the pandemic in Da Nang city in 2020, we found that almost all cases were involved in hospital. The C hospital is a hospital for elderly in Vietnam. So you can imagine how dangerous it is for elderly to get infected COVID. And the Da Nang hospital for general, like all kind of disease and rehabilitation hospital. So all the hospital involved in this pandemics are the hospital that caring for very vulnerable patients. And that's why we also need for transmission control and support, because the healthcare medical staff already tired and exhausted from taking care of the patient, and the hospital have to be closed. All three hospitals are closed, and we need help. That's why we need a quick action to chasing all the possible cases, testing and quarantine all possible cases, so to stop the pandemic in Da Nang. And that's why we're thinking of support from medical students, and our university has been called to support for this pandemic. So immediately in 3 days, we implement student training with the epidemiological and clinical characteristics of COVID, the biological diagnostic technique, the testing for SARS-CoV-2, the measurement to prevent and control COVID-19, including contact tracing and planning for communication in health facility and treatment initially treatment. So we do it for all volunteer students. And then we send students to the field to do contact tracing. We all go out to all house that have people related to any patient before, and quarantine any suspected person and do the testing. So this is all our students. And the COVID-19 in Da Nang city were under control within 45 days. So that is what we did last year. And in this year, during this year, the COVID-19 happened mostly from somewhere about May, and it spread mostly in the south of Vietnam and caused 1,000 of cases each day, so that's why the health staff from the south couldn't control by themselves, so they need to ask for help from other cities. And our students have experience from combating with the COVID in Da Nang city last year. That's why in this year we send staff and students to other province and Ho Chi Minh City to help them with the COVID, and the COVID has been controlled until now. So today is here 25 of October, and we can say we can control the pandemic in Vietnam at this moment. So we call the student back to start study. So lesson learned from the COVID. So we can see that in our countries, like we have a very high density population, and when the COVID spread or any other infectious disease spread, there will be 1,000 or even more cases each day, and it will overwhelm all the healthcare system. That's why within that, the medical students are good sources to help, and they can gain the experience too. And that's why we from the last year and this year lesson, we learned that all the medical students can help very well during the epidemic, and it can apply in future crises. And so what is the COVID's link to climate-related disaster and policy? I was thinking about it when I received the invitation for speaking today. And I think first, when the COVID happened, we forgot about climate change adaptation or disaster risk reduction. We almost forgot all about other health problems. But at the same time, the concept of the whole population and the policymaker has changed. They realize more important of health, more than the environment, the important environment, and change the definition of what a good life is. The COVID reminds us of what is important in this life, not the economic increase or how much money we can earn. It's about safety and health, and then the behavior change. After the COVID happened in the south of Vietnam, during October, we see many waves of people coming from the south back to their hometown because they want to live close to their family, and in general, I can see the reduce in unnecessary needs. Like we don't need luxury to have a good life. A good life is stay close to family and protecting family. And we learn about cross-sectional collaboration. Before COVID-19, when we talking about climate change adaptation or disaster risk reduction, we thinking about other stuff rather than health. And the Ministry of Health not really involved in this process. But during COVID, we see a strong connection. All other militaries and all other sector come to help the medical sector to combat with COVID, because they know that we need that collaboration to survive, to protect our people, to protect our countries. That's why I think we have a strong collaboration, cross-sectional collaboration now. And one thing is fresh air. It's just a joke we talk all day. Like before COVID, in Vietnam, we have a terrible air, which is a pollution, air pollution everywhere, especially in developed cities. And all the air always become red or purple, the color of dangerous air pollution. But now during COVID, we do a lot of quarantine and we stop many industrial activities. And we often talk, we never have that clean air and fresh air in our environment. And that, I think that what is a change, our concept change, our behavior change, and we have stronger collaboration. And that's what COVID helped us to realize and bring to us. And I think all of this is somewhere help us to combat the disaster in the futures. And we're strengthening when we're strengthening the collaboration, we can have in disaster prevention in the future. So that is what I want to share from the experience of Vietnam in combating disasters and also in COVID. Thank you for listening.
Thank you. Thank you so much for sharing with us. I think that was so informative. So you did talk about the policy mapping related to climate change related disasters in the context of Vietnam. You presented from the national and the provincial levels as well. And I think related to COVID-19, I think all the world, I think they lift their hat to Vietnam, I think, because you've been very successful to deal with COVID-19. So although Vietnam's close proximity where the COVID-19 outbreak started, so all people, they expected that Vietnam will have lots of cases of COVID-19. But however, the country opposed these expectations and attained low spread of COVID-19 infections due to its proactive approaches in containing the disease. So I think that is so wonderful. And then we will got to learn a lot from Vietnam. Even Australia, we also learned a lot from Vietnam as well. I think if you go to internet, there are quite a number of published articles talking about lessons learned of COVID-19 mitigations in Vietnam. So now let's move on to China. So we've been to Indonesia, Vietnam, now we move to China. So now we have Dr. Connie, which is the lecturer in public health and health promotions of School of Medicine and Dentistry, Griffith University. and she is also one of the researchers at the Center for Environment and Population Health. So Connie will be talking about the same, or almost the same thing, which is climate-related disaster and health adaptations, but from China perspective. So Connie, without further ado, the floor is yours.
Thank you, Peggy, and thank you, everyone. Thank you for having me. Selamat, is it sore? So on behalf actually for, is it okay that you see my screen or not yet?
Yeah, we can see your screen, Connie.
Is it full screen? Is it okay?
It's not full screen. It's, I think you need to press that tiny little thing. You need to swap the display, I think. Yeah.
Okay. Yeah, I would like to also begin to acknowledge the traditional custodian where I was in here, the land of us, then also pay respects to the elders past and present. And I guess at the beginning of this project, we always emphasize on local knowledge, right? How do we collaborate with people who are have lived experience of disasters, and also the practitioner, the frontliners, who have the wisdom to help us understand what's the situation and how can we better shape and create our futures. So my team in the China team send regrets for not able to be here today. Dr. Liu Tao, Li Xiaoyuan, Xu Ziyu. So I'm actually just the research coordinator of this 3-country program on the. So I will be much more familiar with the overarching findings and the research process, but not specifically for China. But today's presentation will bring some of the ideas and hopefully provoke some conversations and dialogues for everyone in this room. And also, so any questions and comments will be welcome for your feedback as well. So I guess in China, we knew that it's one of the countries that are recording a lot of natural disasters, especially climate-related disasters. So in the past 20 years, this was published in 2020 by UNDRR, saying that China has the highest number of recorded natural disasters in Asia, and also one of the highest in the world. So in Lancet also, they are looking at a lot of the heat waves and floods that are actually high records and unprecedented. So a lot of the unexpected places have emerged a lot of disasters and extreme weather events, and also related to see how those vulnerable populations been affected by these disasters over the years. This is another chart as well. But also linking with COVID, it brings great news for the country after having lockdowns and some of the restrictions. Factories are not working. We bring fresh air to the country, as well as Hong was mentioning. There's some good and thing happen and make us realize that the possibility and potential that how people can act in such a short time, unity, and also just addressing one common goals. So I think during lockdowns, we are able to see birds singing, we see greenery, we can see air pollution going down. But at the same time, we are actually not, unfortunately, facing disasters as well. So this disaster happened in Henan, Zhengzhou this year during the pandemic. So it's not just one pandemic that China is facing, but two, also maybe multiple. So this is declared as the millennium of the flood that happened so unexpected. More than 200 people are displaced and forced to evacuate. Rain, heavy rain, and a lot of damage and loss in this city, including all the critical infrastructures like hospitals.
时也不能这也没有电，这样吧，昨天到今儿吧，连都有信号，手机这样现在都有信号，这样都没信号，这没法说，没有了家都麻了，人也没有了，家也没有了，啥没有了。
So I guess flood events can, it's happening all around the world, especially in Indonesia as well. In this audience, you are very familiar and really, strongly related with this experience. But this time in Henan, it's 1 in 100 years.
我们第一时间就启动了防汛预案，小区防汛应急预案嘛，然后堵得好好的，没想到这河里就决堤了，然后水流当时非常大，我当时我印象中就是我去拍照片，那堤库口，我看水流急没敢往前去，离多远我下去，刚下去水流就把我冲倒了，然后我举着手机坐在下面，还没完全下坡到水还浅，然后鞋也冲倒了。
我们精神很紧张，整个也就睡不着觉，包括半夜就一听到有人喊，就立马就赶快起来了，趴到窗户那儿去往外看，还有这个政府能不能管一管？我们这损失这么大该怎么办？
So I guess during the whole pandemic, we heard a lot about unprecedented, this word again and again. And we now know that climate change is the driver with all of this natural disaster, making it more frequent, more intense, and hard to predict. And during this flood, a lot of the scholars started to also reflect that, is our plan working? We do have a plan. We do have a managed disaster risk management plan, but is it working? How do we make sure this plan works when we need the most? And also a lot of the questions are asking also like, how can we better predict and also address and also respond to this flooding and all, sorry, it's moving. So the literature and research between disaster or climate related disaster and COVID are still very thin. Scholars are starting to look at how do we look with a climate lens into health emergency, and how do we also better response. And starting always, we look at what are the health impacts of all this. Sorry. And there are a lot of overlapping and commonalities between the flood or disaster health impacts and also the COVID and health emergency impacts. And how do we actually combine and integrate them to have a better effective management and response? So in this project, the China team also reviewed the scientific literature, research, and evidence on climate-related disasters. not just the English published papers and also in the local language, the Chinese Mandarin language papers. So throughout the years, we can see the type of disaster that are most researched is actually flood and heat wave. These two climate-related disasters are most studied in China. A lot of them are using cross-sectional or correlational. So after the event or one time at the point, they see what is the health impact after this event. So we are also looking at, there are a lot of missing continuity or longitude follow-up research that are telling us much more evidence on how are we addressing or reducing the risk of disaster risk. So the health impacts from the disasters are also mostly look at death, mortality, or course of mortality, similar with the in Indonesia or in Vietnam. It's also the limitation of the study designs of this research. Then we can see from the comparison of health impacts, flood, heat wave, mostly we focus on infectious diseases and also just the mortality. So from the hospital data that we can see. So the evidence are not very rich to tell us actually what are the main or the different kinds of disaster and what are the health impacts that we can avoid or prevent before the disasters or prepare for the health system to respond to address these kind of challenges. In the policy side, we also review what are the climate-related disasters in terms of addressing the health impacts of vulnerable populations. So we can see some of the documents are coming out, emerging throughout these years. We have rules, regulations, and some of the administration's documents. So we can see the predominant disaster that are studied in China, mostly because of flood and heat waves. Then the health impacts, most majority look at the single infectious diseases or just mortality, the all cause of health impacts. Then the main study design that are adopted is correlational or just cross-sectional, just seeing one point at a time, the study design. So it gave us very limited evidence or knowledge about how is it impact throughout short or long term. From the policy documents, we also learned that a lot of them just focus general disasters. So it's not very specific which kind of disaster that are corresponding with what kind of adaptations or who are the vulnerable populations that we need to design specific or unique adaptation program targeted to these vulnerable populations. So in the findings, mainly saying we can see China government has a strong commitment to combat climate change. And there's prevention and response efforts with the climate-related disasters, mainly focus on infectious disease control. And they're studying also some of the climate adaptation or adaptive climate smart cities, and also some of the focus and emphasis on health system. So there are some good practices, which we will also be document and collect. And some of the early warning system with the buildings and infrastructures. I'll just skip this. If anyone who are interested, you can. Then I think the team also identified some of the gaps and challenges. Seeing a lot of the efforts on climate change are on only reducing emissions. So shifting to alternative energy. There is a lot of one size fits all strategy from the national until the local level. Then it have very lack of attention on local needs. How do we actually address those needs and in a local level? So I guess combining with the experience and I think that from the pandemic, the team also would like to propose some recommendations. Firstly, the formulation and execution of law and regulation. We knew that it's possible to have very fast and effective action? How do we clarify all the sector and department rules and regulations? How do we share data to facilitate better communication and collaborations? And also, how do we link health emergency and disaster preparedness and climate change adaptation? So going back to the point from Hung, how do we link DRR-CCA with health emergency? And I think in this almost 2 years time, everybody has a lot of wise wisdom to how to deal with COVID in different country and at multiple level. And how do we also put priority in research to better inform us to identify the needs of vulnerable populations? And I just want to thank you.
Thank you, Connie. Thank you so much for the presentations. I think it was also a very interesting video as well. Thank you for sharing that video as well. And so I think all speakers all speakers have presented their 4 points. So I would like to open. So because we don't have much time left, to be honest, so I would like to probably maybe invite, if there is any burning questions, like maximum probably 2 questions from the participants. I understand, maybe you've been, I think your conference, I think it's a full day conference, right, Dr. Okta?
Yes, this is the first day and we still have another day tomorrow.
Okay.
For the parallel sessions. If I may add, because from Vietnam and China already presented the finding of our scoping review for the scientific article, I've already put in the chat our new published manuscript. This is about the scoping review of climate-related disaster in China, Indonesia, and Vietnam. So this is more on the scientific article finding. And for Indonesia, we're still preparing for the publications for the manuscript for the health adaptations policy. So if you want to read more information on our finding on the scoping review for the scientific article, please follow the link.
Thank you, Dr. Okta, for sharing the articles. Something after hearing what like Connie mentioned about the collaboration against, I think COVID-19, climate change, disaster, so different threat but the same approach, which is multi-stakeholder collaborations, right? So I think that was one of the most difficult part, right? So I'd like to invite, if there is probably, because I can see there are a lot of experts as well coming to this room. So probably if you can provide some comments or maybe some more inputs or even questions as well. So if there's anybody who would like to ask anything, I think because participants cannot write anything in the chat box, because I tried to write something in the chat box, but I couldn't. So,
oh yeah, sorry for that, because it is only a co-host
yeah,
to put something in the chat.
Maybe participants would like to ask, but they cannot because they cannot put their questions in the chat. So you need to turn on your microphone and speak up.
Can I give some comments, probably?
Yes. Okay. Please, Dr. Samsidik.
Yeah. Good afternoon. I don't know. Good morning, probably somewhere. Thank you very much. My name is Shamsidik. I'm director of TDMRC and friends of Lina Suryani Oktari. So, yeah, I been involved in some publication related to climate change and disaster risk reduction and how to integrate the two issues in the context of Indonesia. Now, another issue coming in on COVID. So these three aspects, in my opinion, quite challenging in the context of Indonesia, since when we investigate how to synergize between issues of DRR and climate change, we noticed that the stakeholders who work on these two issues are different in majority. It is very difficult to integrate the two issues between DRR and climate change. Now another one coming in on COVID. So I believe the stakeholders will be also different in the context of Indonesia. I'm not sure with other countries, but I learned several other countries like Sri Lanka, India, and some others. They do have similarity in this aspect. So why then this become a problem? Because actually disaster risk reduction and climate change, they intersect to each other in very big portions. But who do this, the issues, I mean, who run the activities in the field, they work with different agenda and different schedule, and sometimes overlap and redundant. So probably this one of the thing probably Okta and other friends could consider to investigate how these three issues can be then integrated to each other without repeating the same, if I can say, mistake between DRR and CCA. So then we can have more efficient effort in the country level and also at the local level. So thank you so much for having this session. Yeah, thank you also for experiences and ideas that you share in this session. Thank you.
Thank you, Dr. Samsudin. I think that was more like, comments and also recommendation for future research. And not to mention as well, probably there will be another pandemic as well. So we need to be really prepared, expect the unexpected. So that is something that we need to really make sure that we all in that position at the moment. So anybody just would like to invite one more, like participants to share or to comment or to ask questions. Maybe not to ask questions anymore because we only have another 2 minutes before 7:30 p.m. in Australia, in Brisbane. Anybody would like to ask anything? Burning questions, burning comments? Or could I please ask probably just 30 seconds for each speaker to provide their closing remarks, if that's okay? So 30 seconds, can you do that? So, all right, so probably we can start with Okta. Okta, please.
Okay, thank you very much, Febi. It's not a closing statement, but just a response to what Pak Samsidik said about the coordinations, because we already have a specific and intense discussions with the National Disaster Management Agency and the Ministry of Environmental and Forestry and the Ministry of Health. And also we found that there is a hope to have a better coordinations between the stakeholders involved in the climate change or disaster or COVID-19 pandemic, because there will be a joint secretariat and also a dashboard monitoring, which is related to the national plan on disaster management. So hopefully with this platform, we can have a better coordinations in dealing with the climate change, disaster and COVID-19 pandemic. Maybe that's all from me. Thank you.
Thank you, Okta. Let's move on to Hung.
Thank you for having me today. And I totally agree with Okta. What we learned today is about collaboration, the importance of helping each other and sharing the idea of what can we do and what can we do better. And I hope that from just conference, we can have more opportunity to share our ideas of collaboration and sharing experience among our countries in the future. Thank you.
Thank you, Han. Connie.
Thank you. I think just to be here that we have to also compete with other three rooms, right? So a lot of competing agendas also wanted our attention, and how do we reprioritize? I guess this session just also reminds me the importance of learning, and when and what should we, how many people do we need to see die because of disaster that we start to act and we start to realize that our plan doesn't work. So when and what are the mechanisms that we have in place to help us realize that this is not good enough, that we need to change and readjust to adapt the future emerging and also the future pandemics. So the mechanism of what and when we should rethink and readjust, that is the important message, I guess, I learned throughout the sharings and presentation from other panelists. And it's very touching to see everyone here. Thank you.
Thank you, Connie. I think everyone has already shared their closing remarks. I think one of the most important part will be, I think this is also what Dr. Samsidin has already mentioned as well, to find the linkage between all these different, different threats. But one of the most challenging part will be, it is not about finding the linkage on the paper, but how we can make sure we can invite different people coming together and sit down on the same table and discuss what will be the potential solutions for our communities. I think that is one of the most challenging part. And so on that note, so probably I would like to close this session. So I understand the conference is still ongoing, so hopefully you can have enjoy the rest of the conference. And thank you so much for all speakers and also for all participants. And hopefully, of course, this is the era for us to collaborate. Not only, I think now, conference for me, it's not only about sharing knowledge, but it is also about expand our networks. So thank you so much. I would like to return the floor to the MC. Mbak Ica.
All right. Thank you so much to Mr. Febi for running the insightful sharing session with our great speaker today. Thank you to Dr. Rina Suryani, to Dr. Hong Swanyan, and Connie Kairugan for addressing health adaptation policies and strategies toward climate-related disaster and COVID-19 in Indonesia, Vietnam, and China. Ladies and gentlemen, we have had productive and inspiring time together, and this event is about to come to very end. I hope you found the presentation very insightful, and we can provide the future health innovation in disaster risk reduction in the future. Last, I would like to deliver my gratitude once again for your attendance today. Have a good rest. Thank you so much.
Thank you. All the best.
Thank you, everyone.
Well.
Thank you, Pak Febi,
Bye-bye.
Connie, Pak Sidik.
Terima kasih. Aman.
Terima kasih, Ica.
Aman.
Thank you.
In terms of looking for an efficient and sustainable way to support them, schools are a really good option.
Terima kasih Mbak Rina.
Oh, sama-sama Pak Ana.
Mari di Jogja, barusan adzan maghrib di Jogja. Mari azan di Yogyakarta. Terima kasih semua.
Iya, Pak. Ya,
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.